Hello, dear colleagues. My name is Martin Reck. I'm coming from Northern Germany. I'm a pulmonologist by training, and I am working in a dedicated lung cancer center in the north of Germany. And it's my pleasure to be here with you at the WCLC 2025 in Barcelona. So I have the pleasure to talk about the highlights of the last plenary session, and I think we have three really important presentations seen there. The first one has been the update of the FLAURA2 trial, investigating the combination of chemotherapy and osimertinib alone versus osimertinib alone in EGF receptor mutated patients. We already do know that there is a significant improvement in progression-free survival. Now we have seen the overall survival update, and we do see also a significant prolongation of overall survival and a meaningful prolongation of overall survival in favor of the combination of osimertinib and chemotherapy. Along with that, what we also have seen has been the outcome that there hasn't been any increase in the adverse events. So there were no new side effects, and overall the tolerability was quite acceptable. The second presentation was a little bit in the second-line treatment of EGF receptor mutated patients, where we have seen an update on the combination of ivonescimab and chemotherapy compared to chemotherapy alone as second-line treatment for EGF receptor mutated patients. In the HARMONY trial, we already know that there was an improvement of progression-free survival. We have seen an update confirming the significant prolongation of progression-free survival for the combination, but now we also have seen overall survival data. And it has not been a significant improvement in overall survival, but there's a very strong trend in overall survival favoring the combination of ivonescimab and chemotherapy. And again, when we look on the safety adverse events, in particular when we look on the adverse events of interest, the immunotherapy related and the angiogenesis related adverse events, there was no new information. And the third very important abstract was on another oncogenic entity. These were ROS1 alterated non-small cell lung cancer patients. And there we have seen an update on data for a new compound, zidesamtinib. And we have seen quite remarkable clinical efficacy data in pre-treated patients in terms of response, but also in terms of progression-free survival. Also in patients who had already received advanced TKIs like repotrectinib. And together with a very favorable safety profile, this is clearly a drug of high interest for the future development. Overall, the IMforte trial was the first trial showing the efficacy of the approach of maintenance treatment in patients with advanced small cell lung cancer. So patients received already 4 cycles of first-line chemoimmunotherapy, and then they were randomized to a combination of lurbinectedin and atezolizumab compared to standard atezolizumab maintenance treatment. And we have seen a significant improvement in both co-primary endpoints, progression-free survival and overall survival. And as mentioned before, this has been the first trial showing this efficacy in the maintenance setting. I think for patients with small cell lung cancer, this is a good story because there is the risk of progression during the maintenance treatment with the checkpoint inhibitor. And we know that only very, very few patients can survive for a long time. So any chance to enhance the fraction of patients with a long-term stabilization of the disease is highly welcome. And here at WCLC, we have seen an update on the safety data. It's true, we do see a higher frequency in the combination arm, mainly hematological toxicities and constitutional toxicities, but the majority of these adverse events were grade 1 and 2, and the majority of these adverse events happened during the first 9 to 12 weeks of treatment. So overall, we do not see any new side effect with this updated analysis, and we do not have any sign of a cumulative toxicity over the period of the maintenance treatment. So I think this is a real new chance for our patients with small cell lung cancer. Well, development of biomarker for guiding patients with advanced small cell lung cancer is a very difficult story. We have looked on conventional markers like PD-L1 expression, tumor mutational burden, and others, and we didn't find any correlation to the efficacy. We also identified some genetically determined subtype, which probably have some correlation to the efficacy of immunotherapy. The problem of these markers is the observation that they are also very strong prognostic markers. It's very difficult to differentiate the prognostic from the predictive quality. Having said this, I think this is ongoing research. We are a little bit far away from customizing the patient for a certain treatment in small cell lung cancer, and we really have to try to maximize the intensity of our treatment opportunities as early as possible. Well, when we look on the future of small cell lung cancer, we have seen now the IMforte data, but this is just the beginning. So we have a new class of immunotherapies coming up. We have the T-cell engagers. We have seen the randomized trial of tarlatamab versus chemotherapy in relapsed pre-treated patients, showing a significant benefit in overall survival. So this is a new class coming into the treatment field of small cell lung cancer, and obviously will come also to earlier stages, maintenance stage, or even first-line treatment. And we have other agents of interest like the ADCs, which are currently in broad investigation. And we have the bispecifics. So we have the anti-PD-1, anti-VEGF antibodies, which are now also have been introduced into the first-line treatment of small cell lung cancer. So there is a lot of new data coming up in the future of small cell lung cancer.